Why heart health is so important. Heart health should be important for obvious reasons, but many people focus so much on cancer prevention, that they forget heart disease is the #1 killer worldwide of both men and women. In the United States, heart health is considered to be a man's problem. While it is true that more than 390,000 men have heart attacks each year, it is also true that more than 271,000 women experience them. Studies have also shown that women have less favorable outcomes than men because they do not always suffer the same dramatic symptoms as a man having a heart attack. A heart attack is triggered by a severe or complete cutting off of the blood supply to the heart via one of the main coronary arteries. Those with coronary heart disease will often experience a narrowing stenosis of the arteries due to cholesterol, which forms what is called plaque. The plaque buildup on the blood vessel walls leads to hardening of the arteries. The plaque will either cause the vessel to become so narrow that the tissue of the heart starts to become starved of oxygen, or a part of the plaque will break off to form a clot, which can then get jammed in a narrowed artery and cut off the blood flow completely. If this happens, any heart tissue served by that blocked artery will die, and if enough damage is done, it can lead to severe consequences. Since time is of the essence when it comes to stopping a heart attack in its track, an untreated heart attack will continue to cause damage to the heart, resulting in tissue death and perhaps even actual death. Statistics show that up to 50% of women who have a heart attack die within the first year. Studies have also shown that by the time she is in her 80s, a woman's risk of a heart attack becomes equal and then greater than that of a man. Heart disease kills more men and women each year than the top 10 causes of cancer combined. Even the most lethal of cancers, lung cancer, only kills around 66,000 people per year. We should not minimize these deaths in any way, but we should make heart health our first priority. Fortunately, a lot of what is healthy for the heart will be healthy for the whole body as well, and can therefore lead to effective cancer prevention too. So let's get started with your road to better heart health and overall health. It's time to start your first week of your 21-day challenge. Week 1, getting started. In your first week, you will be laying the foundation for your heart-healthy lifestyle. The most important part of this process will be starting realistically from where you are in your life in terms of health, diet and level of activity, and then gradually adding heart-healthy tactics each day, or beginning heart-healthy steps that will give you excellent results if you keep up the good work. Let's get started with your first big day. Day 1, know your numbers. We will start your first day of your challenge by looking at the most important numbers you need to know in relation to your current state of health. In this way you can make informed decisions about your heart-healthy goals as you work your way through the 21-day challenge. If you have been to the doctor within the last 3 months, your first step is to call them to ask about your readings for the following. 1. Blood pressure 2, weight and heights 3. Blood glucose reading 4. Total cholesterol 5. LDL cholesterol 6. HDL cholesterol 7. Triglycerides. If you have not been to the doctor recently, make an appointment. When you get the results back from your tests, treat that as the first day of your challenge. 1. Blood pressure is an important number because it measures how much force is inside the arteries when the heart pumps. Too much force can lead to hardening of the arteries. 2. Your weight and height are used to calculate your body mass index, or BMI, which is an indicator of whether or not you're a normal weight, overweight, or obese. 3. Your blood glucose level will determine whether or not you are healthy, prediabetic or diabetic. Those with diabetes frequently have heart health issues and a number of other serious potential problems if they do not keep their blood sugar under control, such as damage to eyes, kidneys and nerves. Items 4 through 7 are all related to your cholesterol levels. Cholesterol is a waxy fat in our bodies produced by the liver. It is also consumed as part of our diet if we eat food derived from animal sources, such as meat, dairy and eggs. LDL cholesterol, or bad cholesterol, think L for lousy, can contribute to hardening of the arteries. HDL, or helpful cholesterol, can keep arteries free of clogging LDL cholesterol molecules. High triglycerides come from animal foods and high carbohydrate diets and can contribute to weight gain if you are not exercising regularly in order to burn the calories you are consuming instead of storing them. Once you know all 7 of these numbers, note them down in a new heart health diary. This will help you track your progress during the challenge and as you keep up the good habits you will begin over the next few weeks. You might have an issue with one of the 7 numbers, 2 or 3, or even all 7. Here are the normal ranges for all of them, with the exception of BMI, which we will discuss in a moment. 1. Blood pressure normal as 120/80ths, red as 120/80. 3. Blood glucose normal as between 4% and 6%. 4. Total less than 205, LDL less than 106, HDL 60 or more. 7. Triglycerides less than 150 for the BMI. First calculate it and see where your number falls in terms of the ranges set. If you are in normal range, great. If you are not, look at the tables to see what is a normal BMI reading for someone of your height, and what weight would be a good target to aim for. Consider aiming for the middle of the range so you don't need to worry about a couple of pounds creeping on, meaning you end up in the overweight bracket. If you have to lose weight, write down that target number for future reference. Now that you are more organized, you will be ready to set personal goals.